If you are watching this presentation, you are likely considering a total knee replacement, also known as a total knee arthroplasty, as a way to treat your chronic knee joint pain. This presentation will provide you with some basic information you need in order to know if knee replacement is right for you. If we haven't already met, my name is Jake Stanfield. I am a fellowship-trained orthopedic surgeon specializing in hip and knee replacement surgeries, including complex revision surgeries. With the help of our specialized joint replacement team at Cadlick, I perform hundreds of knee replacements each year, so I am confident in our combined experience to get you the best outcome possible. We are all committed to providing you excellent care and preparing you to make the right decision regarding knee replacement surgery and guiding you through the recovery process. So, what exactly is a knee replacement? This surgery is performed to help alleviate severe pain and dysfunction in the knee due to conditions that leave the knee worn out. This could be from wear and tear, trauma, or disease. During the surgery, an incision is made in the front of the knee, and the damaged knee surfaces of the femur or thigh bone, tibia or shin bone, and the patella or kneecap are removed using a saw and special instruments, and then resurfaced with metal implants. A plastic, also called polyethylene, liner is then attached to the tibia component, and this will articulate smoothly with the metal femur. How does a person know if a knee replacement is right for them? Knee replacement is performed to improve pain and function during daily activities such as walking, using stairs, and moderate exercise. Knee replacement is not for minor symptoms. If symptoms are severe and non-surgical treatments have failed, then knee replacement may be a good option. Some examples of severe symptoms include pain most days of the week with simple daily activities such as walking or using stairs, pain that interrupts sleep or prevents you from performing regular exercise, pain that causes you to give up recreation or work activities, and pain that negatively impacts the quality of your life. What is the expected recovery after a total knee replacement? Most people will be discharged on the day of surgery, and the rest the next day. Very few people will stay in the hospital longer than one night. During the immediate recovery period, or the first 1 to 2 weeks, you should anticipate significant pain and swelling that peaks at about 1 week. Most of your time will be spent resting, icing, and elevating the leg. You will be allowed to put weight through the knee, but you will be using a walker. You will be able to shower immediately because the incision is repaired with absorbable sutures and sealed with glue, and a waterproof bandage is used. Physical therapy begins within a few days after surgery. An appointment will be scheduled 2 weeks after surgery to monitor your wound healing, remove the dressing, and assess your overall progress. 2 to 6 weeks after surgery is the early recovery period. Pain and swelling will gradually improve. Icing and elevating is still very important, but your activities will increase. You will transition from a walker and then to a cane, and then to no cane at all when you begin walking without a limp. Physical therapy will continue 2 to 3 times per week until about 6 weeks after surgery. The goal for your range of motion at this time will be 0 to 120 degrees. At this time, typically about 4 weeks after surgery, we can consider returning to driving and return to light work such as office work if desired. An appointment will be provided at 6 weeks to confirm these goals are being met and to obtain x-rays of your new knee. 6 weeks after surgery, most people report improved pain and function when compared to their knee prior to surgery. 2 to 4 months after surgery, you should notice that this pain and swelling is still present, but will be substantially improving over time. You will notice improved strength with a regular home exercise program. You can begin desired activities and return to regular work in most situations. You should anticipate that you will be approximately 80% recovered by 4 months after surgery. In the later recovery period, which is 4 to 12 months after surgery, you should experience minimal to no pain or swelling. Notice improving strength and endurance. You can resume normal activities and begin more strenuous work or recreational activities as desired. It is important to know that knee replacements typically improve for up to 1 year after surgery and sometimes longer. It is also important to know that knee replacements are not normal knees. They are mechanical substitutes for a normal knee. There might be some mild annoying symptoms that are normal for many people with knee replacements, including numbness around the incision, limitations with strenuous activities, a metal on plastic clunking sensation or sound, a feeling that the knee is not natural, discomfort when kneeling directly on the knee, and swelling with overexertion. With any surgery, there are risks. The general risks of surgery include heart attack, stroke, blood clot, and death. Fortunately, these complications are very, very rare. Pain should be expected and is the worst during the first 2 weeks and then begins to gradually get better. Residual pain can be present and gradually improve for several months. Infection is one of the most devastating complications after knee replacement surgery. It occurs in less than 1% of all knee replacement surgeries and usually in patients with significant risk factors. It typically requires additional surgeries and long-term use of antibiotics to properly treat the infection. Treating an infection in a knee replacement can be a long and frustrating process and can lead to permanent disability in some instances. Bleeding. Several methods are used to maintain minimal blood loss during and after the surgery. Very rarely will a patient require a blood transfusion after a knee replacement. Deep vein thrombosis, or pulmonary embolism, also known as blood clots. A blood thinner will be selected for you to take after surgery to help prevent this rare complication. Stiffness. If expected range of motion is not achieved by 6 to 8 weeks after surgery, a manipulation can be performed where the patient is placed under anesthesia and the knee is gently moved into more flexion to break up the scar tissue. Dissatisfaction. Up to 20% of all knee replacement patients in the literature have reported to be dissatisfied with the outcome of their knee replacement due to continued pain or dysfunction, even if the knee is functioning well without complications. This is a complex issue, but dissatisfaction in general can be avoided by the following: having reasonable expectations, only consider surgery for severe symptoms, not mild symptoms, attempting non-surgical treatments such as medications, injections, physical therapy, bracing, and weight loss. You should also have defined degenerative joint disease such as severe knee osteoarthritis or bone-on-bone osteoarthritis seen on x-rays. There are some medical conditions that need to be optimized prior to considering total knee replacement. First is diabetes. Blood sugar levels should be well controlled, and a hemoglobin A1C should ideally be less than 7.0. If this lab value is elevated, surgery should be delayed until changes in your diet or medications can correct the issue. Obesity. Weight loss is important for anybody with knee pain, but a body mass index, or BMI, of greater than 40 is associated with a significantly increased risk of complications. And if the BMI is above 40, weight loss should seriously be considered before proceeding with knee replacement, if at all possible. Tobacco use. Smoking and using other forms of tobacco is associated with an increase in complications, and smoking cessation is required prior to proceeding with knee replacement. Smoking cessation should be completed at least 4 to 6 weeks prior to surgery and a test will be performed a few weeks prior to surgery to confirm that you have quit smoking. Surgery may be canceled if this test is positive. In summary, if you have severe knee osteoarthritis or conditions that have left the knee cartilage significantly damaged and non-surgical treatments have failed to provide relief of your severe symptoms, then knee replacement is a good option for you. Once you have made this decision, a surgery date will be chosen, and then several things will automatically occur in order to prepare you for your surgery and postoperative recovery. First, a preoperative appointment will be made with our physician's assistant. During this visit, we will confirm that you have everything you need for a successful recovery. We will discuss a specific plan for pain medications, select a blood thinner, provide you a prescription for a walker and a temporary disabled parking placard. A discharge plan and a physical therapy plan will be confirmed. It is also an opportunity for you to ask additional questions. Essentially, this visit is a preoperative checklist. A prehab appointment will also be scheduled where you have the chance to work with a physical therapist and our nurse navigator who will prepare you with exercises and provide you with knowledge you need to confidently recover safely at home. The hospital will also contact you to schedule a time to obtain preoperative labs that help us and the anesthesia team perform surgery as safely as possible. I have no doubts that you will have additional questions or concerns regarding your specific situation. Please write these down and ask them. We want to address these concerns because your understanding, preparation, and participation is critically important to a successful outcome. This presentation has only included the basic information required to make an informed decision whether to proceed with knee replacement surgery or not. There will be other information you will need to know as you navigate your joint replacement journey. These will be provided to you at that time. Joint replacement is very routine for us, but we realize this may be the first and only time you undergo a joint replacement, and with that comes uncertainty and anxiety. Although these feelings are normal, I hope you feel comfortable placing your trust in me and our team to do our best work. Thank you for listening.